So this video is for basic facial, and we always start as if we just arrived to work. So the first thing that we're going to do always is wash our hands. So we're going to go to the sink, wet our hands, and get about a coin-sized amount of liquid hand soap, wash our hands down to the wrist, and then of course we're going to wash the back of our hands down to our wrist. We're going to wash our fingers, and we're going to wash the backs of our fingers. We're going to wash our fingertips and nails. We will wash between our fingers. We'll wash between our fingers and our thumbs. We're going to wash our thumbs. We're going to wash our wrists. And we're going to do all of that interlocking washing for a minimum of 20 to 30 seconds. And when we feel like we've gotten a really good, proper wash, we'll rinse thoroughly under the water. And then when it's rinsed, we'll find either disposable paper towels or a towel. Grab that, turn the faucet off with the towel, dry our hands completely. If it's disposable paper towels, they're going in the trash. If it's a towel, it just goes in a closed container until time for laundry. And then we grab our hand sanitizer that is 70% ethyl alcohol, and we sanitize our hands thoroughly. And once we have sanitized, we then need to prepare our workstation and area for our client who's coming in for a basic facial. And you want to do everything you possibly can before your client arrives. Obviously, you're going to make that facial bed. We're going to go over all the details. But you are a service provider that has a specific time for your client's appointment. So you want to make sure that you are very conscientious about their schedule, your schedule. You may have a booked day. You really need to be on time, and you need to learn that time management. But also, it's very professional. So it's important for you to do everything you possibly can before your client gets there so that you don't waste time preparing once they do. So let's review how to prepare. So of course, we're going to disinfect our workstation, bed, and equipment using a disinfectant wipe and following manufacturer's instructions. We're going to check equipment to ensure all devices are in safe working order and plugged into a working receptacle. We're going to gather clean supplies needed for the facial service, and we're going to store in a clean, closed container. We will turn on the hot cabbie and stock with at least 3 clean, wet towels. More may be needed depending on the service and the client's needs. And then we will fill a clean steamer glass with distilled water. We're going to preheat that facial steamer. We will dispense products needed for the service according to the skin type and client's needs as follows. Prepare disposable portion cup tray for each product with a portion of the product by opening the top of the container and ensuring the tip of the nozzle does not come into contact with the disposable portion cup tray, or you can remove the product with a disinfected or clean single-use spatula. Close the lid to the product and set the portion cup tray on the tray. You're going to drape your facial bed using 1 fitted sheet, 1 flat sheet, and 3 towels. Place clean laundered sheets down on the disinfected facial bed. Placing a towel horizontally at the head of the bed, lay a hairnet and headband on top of the first towel, along with a rolled towel to support the head and neck of the client. Save the third towel to lay across the client's décolleté. So we'll do all of that prior to client arrival. If you don't know the skin type of the client, you can certainly have containers pulled out, products pulled out, and then you can dispense them as needed while the client maybe is getting ready or once you get the client comfortable. So let's talk about what I have on my tray to perform the facial. I've got cotton rounds, 2x2s, and 4 squares. I have toner, I have water, I have makeup remover, I have astringent, I've got cleanser, exfoliant, massage product. I've got a mask, eye cream moisturizer, I've got a brush to apply the mask. I've got these individual disposable sticks so that I can scoop stuff out. And then I have wooden stick Q-tips and disposable gloves to perform extractions if my client needs that. So I have everything I need set up and ready to go. And the client that is coming today is an existing client, so I kind of have pretty good idea of our plan. However, I'm always going to do that professional skin analysis, and we're going to just double, triple confirm that everything's okay. We're going to go through all of the same steps we always do with the client consultation, recheck, review the form, go over everything that's been going on at home, and if they've changed anything, medications, all that. We're going to go over all that. So the next thing that happens is you have to do your client consultation. So just note that before I meet with my client, I have clean hands. I've washed my hands upon arrival. I would wash them before I met the client, and then of course I'm going to wash them before I would start the service. But just so you know, I have clean hands when I go and greet my client. So I'm going to go greet my client, and let's talk about the client consultation step. So we greet the client and escort them to the work area. We determine the client's preferences, and we assess the client's needs. We assess the client's skin by performing a skin analysis, and at this point it's just by looking at their skin to ensure that they're, like with, while you're having a conversation, I mean looking at their skin, you're always looking at their skin, but not under a magnifying lamp or Woods lamp, not with cleansed skin, just simply looking at their skin. And you're ensuring that there is no inflamed, infected, broken, raised, or swollen skin in the area to be worked on, or an open wound or sore in the area to be worked on, infection or infestation, for example, lice, to prevent from safely performing the service. You will assess the client's consultation form for any medications and products used within the last 72 hours and consult on any known allergies. You'll consult with the client on any facial surgeries within the last 3 months, and if the client is under a physician's care. You'll assess if the client is prone to cold sores or fever blisters. You'll assess if the client has used exfoliating or lightening agents within the last 72 hours, like alpha hydroxy acids, beta hydroxy acids, hydroquinone, etc. You'll assess facial injections within the last 3 weeks, like Botox or hyaluronic fillers. We're just going to briefly touch on this. But this is where you really spend a lot of time, and you do ask a lot of questions if needed, and you certainly will be doing this in a private area so that you can have that communication. If there's something that you don't know what it is, for example, a medication, etc., take the time to look it up, make sure there's no contraindications. So obviously we asked about medications. We also are talking about allergies that they know about, because you need to make sure that they're not allergic to anything that's in a product that you're planning on using. You're going to talk about facial surgeries, and then cold sores or fever blisters, especially if there's anything at all going on or you see one. No way, Jose, are you going to perform any service. They're highly contagious. That's not going to happen. I'm sure the client knows that as well, but you're going to reiterate that. And then obviously with exfoliating or lightening agents, not only do they make the skin extremely sensitive, they could potentially make it thinner. Lots of stuff going on with that. Fillers, you're not going to do that. You have to wait over 3 weeks before that happens. And then luckily for us, our client is free of any of those contraindications. But really take the time there. You're going to talk about many more details that are on this, like low blood pressure. If they have a high pain or low pain tolerance. Like there's so many things they're going through. You're going to find out about them. Their medical history, their diabetes, like all diabetes, all the things. So we could go through this for hours about what contraindications are, but you will be doing all of that. So luckily for us, our mannequin doesn't have any, and so we're going to get her set up so that we can start and get ready to perform the service. So we're going to give her privacy and let her go into the facial room and change and get into the facial bed, and then we'll come and help make her more comfortable. So she's going to change into her drape. You're going to close the door, then you're going to come knock on the door, and when she says it's okay for you to return, you can. And let's get her a little bit more comfortable. So we have a roll towel here that we're going to place underneath her neck for more support. An additional towel that I'm going to place over the décolleté just to kind of catch anything or help cover, keep her warm. And then we've got a headband here. And the point of a headband or a hairnet obviously is to keep the hair off the face, out of the way, so that you can perform the service and it's not in the way of your doing that. So just making sure that you've got all that ready to go. And she's cozy and comfortable. And so in order for you to begin the service, you would once again wash your hands. So you wet your hands at the sink. You'll find a coin-sized amount of liquid hand soap, and you're going to rub your hands together down to the wrists. Of course, you're going to wash the back of your hands down to the wrist. You're going to wash the fingers and the back of the fingers. You're going to wash those fingertips and nails. You're going to wash between the fingers. You're going to wash between the fingers and the thumbs. You're going to wash the thumbs. You're going to wash the wrists. And you're going to do all of that washing for a minimum of 20 to 30 seconds. Then you're going to rinse everything under the running water. You're going to get either disposable paper towels or a towel to turn off the faucet and then thoroughly dry the hands. So if it's a paper towel, they're going in the trash. And if it's a towel, you will then put it in a closed container until it's time for laundry. And then you will grab your hand sanitizer, 70% ethyl alcohol. Sanitize up those hands. Once your hands are sanitized, you can begin to perform the service. The first thing that you're going to do is remove makeup. Some clients wear more, some clients wear less, but you do want to take it off. And then you're going to perform the first cleanse of the face. This is to remove any makeup, dirt, debris, so you can really do a good, proper skin analysis. And then I'm going to go ahead and remove that first cleanse. And after you remove the first cleanse, you will go ahead and cover those eyes with cotton rounds or protection. Basically, what we're going to do now is we're going to bring in a magnifying lamp or woods lamp, and you are really going to want to make sure that you're protecting your client's eyes from this bright light. So you're going to tell them what's getting ready to happen, and you are going to be very transparent, and they're going to know that you're protecting their eyes, because you need to get in here and do a really good, proper look. And I don't have a magnifying lamp, so I'm going to pretend that I brought it over and turned it on. And with this process, this is where you really take some time. This is critical in the determination of your client's skin and the skin's needs. So you're looking for all different things on different parts of the face. So when you had that client consultation, you certainly determined through that conversation what your client's concerns were, and also what their hopes for their skin are, which is how you came to the determination about what service to perform, what products to use, etc. This is your chance to really get in there and see if what type of skin they think they have, and then what type of skin they really have will become apparent to you. And also what the best course of treatment is going to be, what's the best products for home regimen to support all of this great work that you guys are going to be doing together to achieve these goals, what is realistic, so that you can communicate that. And also, you are now hopefully this person's skincare expert for some time, skincare professional. So you want to make a full database in either your software system or your client card of what their skin looks like and what's on their skin, from freckling to moles to redness to maybe if they have any kind of like redness, capillary issue, hyperpigmentation, dehydration, fine lines and wrinkles, excess sebum, breakout, whatever it could possibly be that you see or observe. This is now where you're going to go over all the details, and you're going to notate it all. You're going to be able to talk your client through the process of products that you're using as you're working through the basic facial, and also what they're going to do at home to support and why. That whole feature benefit conversation through each step. And then also for your reference point, because you may be the first person that notices a change in something like a mole, and you need to recommend a physician something that might be out of your scope of practice. You want to make sure that client gets the best care possible. That's going to create tons of client loyalty and appreciation, and you being very honest and transparent, and then also being very careful and really being aware of their skin. So we're going to turn the light off and take it out of the way. That skincare, that professional skin analysis is done. And so you're going to take off the cotton rounds, and you can go in for that second cleanse. So that first cleanse was just a nice little bit of removal of makeup and dirt. And now you want to make sure you get it thoroughly clean. And some people may be able to stop with just a second cleanse. Some people, you might have to do a third cleanse. So today on our client, we are going to do all 3 of the cleanses, but you may be able to stop for some people after this step, depending on the client and what they, how they take care of their skin, what they're doing, how much makeup they came in with on, etc. So you'll just be the judge of that every time. And then you can remove that second cleanse. And anytime we apply any product to the face, of course, we are always avoiding the eyes, the nose, and the mouth. And then just because today we're going to be like super thorough, we're going to go ahead and do that third cleanse, of course. So we will go ahead and remove, of course, the third cleanse. And after we cleanse, of course, we're going to tone. And I have a spray toner, and I'm just going to make sure that my nozzle does not come into contact with my two squares. and then you're going to exfoliate. So we're going to add about a pea-sized amount of exfoliant to our client, and you're always going to follow manufacturer's instructions, of course, based on what kind of exfoliant, etc., whether it's a physical or a chemical. You're always going to avoid the eyes, the nose, the mouth, and I am going to massage my exfoliant in with my hands for about 1 to 2 minutes based on my manufacturer's instructions. And once you've massaged it in for your 2 minutes, I'm going to read the next steps because I don't have the equipment necessarily to show you. So let's talk about what we do. So you would retrieve the steamer that we set up, the facial steamer, when we were preparing the space with the distilled water and doing the preheating, and turn the steamer to the on position. You will position it near the facial bed, next to the facial bed, and make sure that it's facing away from the client as the water heats up and emits an even outflow of a mist. Once the steamer is emitting a mist, you can position the steamer 16 inches over the client's face and aimed at the client's chin for even distribution on the face, allowing the unit to function for 3 to 5 minutes. Remove the steamer from the client's face and return the steamer to the previous location for disinfection. So you'd find the steamer, bring it on over here, make sure that next to the bed, turn it on, and make sure that it's facing away from the client's face while it gets its little even flow going. Once that steam is going, you can just position it over the client's face, aimed at the chin, so that it's giving that even outflow of a mist, and then you would leave it there for 3 to 5 minutes. Because we don't have the steamer, and also because we're doing a video, we're going to pretend like 3 to 5 minutes has elapsed. You turn the steamer away, turn it off, return it to where you got it from until you can disinfect it, which would be after you finish the service. And then we're going to remove the exfoliant with a steam towel. I also do not have steam towels already in our special little container. I don't have one of those, so we are going to pretend like this is our steam towel. We're going to shake it out. It's hot. Check the temperature of my wrist. It is okay, so I will also check it on my client's collarbone. She says it's fine, and now I'm going to go ahead and wrap the face, leaving the nose out so she can breathe. And then we will do a gentle press. And you can leave it on there as long as you need. In about 20 to 30 seconds, it's going to probably cool down, and that's when you're going to want to take it off. You'll feel it start to cool down, so then you'll know when to take it out. Don't have one of those hot cabbies, so that's where you would be having your steam towels. So once you feel it start to cool down, you can go ahead and remove the rest of the exfoliant. And when you're finished there, what you want to do is thoroughly dry your hands because you're going to perform extractions if needed. And my client only has a couple, but we're going to do it. You're going to be putting on disposable gloves, obviously, for extractions. So you need dry hands to do that, or it'll make it difficult for you to use your gloves. And we are going to discuss how you can extract. So you could use 2 cotton rounds soaked in astringent, and you could put them on your fingers and work your way around and the cotton round while you perform extractions and then toss it. I'm going to use wooden sticked Q-tips soaked in astringent, which means for each little pair, you throw it away with each single extraction. So we're going to go ahead and do the first. She only has a couple around her nose. She really is in good shape. So we're going to go ahead and perform those extractions. And one thing to note is you don't want to do any extractions, so we're throwing that away. Get 2 new ones for longer than 5 to 7 minutes because it can be painful. You're always going to check in with your client's comfort, make sure that it is okay. Do one more. And that she's comfortable. So that's why you don't want to overdo this. You can only handle it for so long. So those are in the trash, and now you can put your disposable gloves in the trash as well. So 5 to 7 minutes max on extractions. You should definitely keep clients' comfort in front of mind, and you're checking in throughout the whole process as well of the facial. So we have done that exfoliation. We've done the extractions. We're going to finish with a toner. So let's tone again. And once again, when I use my spray toner, I do not come into contact with my little 2 squares. I just spritz it, and then I apply the toner to the face. Once you have done your toner, then the really nice thing is that you get to move forward into massage, which is great. After extraction, she had all that pain. Now she can have some calming zen moment. So one thing to note with your massage, you want to make sure that you have enough massage product available. I'm just going to get a little bit more. So when you go in and you retrieve your massage product, you're going to want to make sure that you get enough massage product on your hands so as not to have to leave your client's face or neck at all before you're finished, so that the client can completely relax. Because if you stop, start, stop, start, it's not very relaxing. It can be actually jarring or uncomfortable. So I'm going to get my massage product and a good amount, so I won't have to leave my clients. Just spreading it out before I start the massage, so I have that massage product placed everywhere that I'm going to be performing the service, so I will not have to leave her to go back into any kind of product. Once again, like I said, because it can be very distracting, and I just need to get one little thing off of my client's skin. Okay. And obviously, if a client has severe acne, this would not be, you would not be performing this part of the service like this. It's very specific, not a lot of massage. You wouldn't want to irritate or activate any additional breakout. Excuse me. And then, of course, you will be removing the massage product. And then you would apply mask at this point. So of course you're gonna follow manufacturer's instructions. I'm gonna apply my mask with a brush. Totally up to you. Once again, you're going to avoid the eyes, the nose, and the mouth. And then you would read and follow manufacturer's instructions as far as time allotment to leave that mask on. Also based on your client's skin, what they're going through, however long you feel like they can handle it too. So depending on what kind of mask it is. So for this particular mask, let's say it's 5 to 10 minutes based on the client. So we're gonna pretend like 5 to 10 minutes has elapsed, and we're gonna go ahead and remove the mask. once you've removed your mask product, you can do that final tone. And of course, I'm going to make sure that my nozzle doesn't come into contact with my 2x2s. And then, of course, I'm going to apply her skincare. So it is dark out. She is going to go home. So I'm going to apply eye cream, and I'm going to apply a more of a nighttime hydrating moisturizer. We have already been through her daytime routine. So let's apply a little bit of eye cream to the ring fingers, our most delicate fingers. And we're going to do a light tap on the zygomatic arch and the brow bone. And she's definitely concerned right now with premature aging around the eye area. So we do have actually 2 eye creams for her. 1 eye cream during the day and 1 at night. And she's going to she's already had said that she wants to go ahead and take those on the way home. And then we've got a nighttime moisturizer, and we did talk about the importance of SPF. So I think that her plan is to take her daytime moisturizer with SPF and double check with her nighttime moisturizer to see if it has some of the ingredients that we recommend in it. So we're applying that hydrator so she'll be able to be ready to roll. When she gets home, she can just put her jammies on. She doesn't have to wash her face anymore. And we're going to, of course, do a lip product because everyone wants to leave with nice hydrated lips. And then, of course, what you would do is, her skin looks amazing. Present her gorgeous skin to her. And give her some privacy to get dressed so that she can then meet you out in the client consultation area once she's dressed so that you can review all of her maintenance and aftercare. So of course you're going to do that, and you're going to get a nice review of her routine to make sure that you have pulled aside products that you recommend for her home care regimen, because remember, she is with herself at home more than she is with you. So making sure that she has all the things she needs to get the most out of this treatment, she's all about it. So we're going to go get her checked out. We're going to get her next appointment booked because we have a schedule. She's an existing client, like we said at the beginning of the video, and she's very focused on achieving her skincare goals. So she's doing all the right things, which is wonderful. So we've got her rebooked for her next appointment. We're getting her checked out, and then you've got another appointment coming in, so you need to get back to your room to prepare for your next client that's coming in. So the first thing you do when you get to that room is if there's any single-use items that are disposable, you need to go ahead and throw them away that you haven't thrown away already. You, of course, are going to take any implements that you might have, put them in a closed container until later, labeled to be disinfected, and then you're going to take all the sheets, the towels, all the bedding, everything that you've used, you're going to put it in a closed container until time to be laundered. Then you're going to identify a proper cleansing agent. You are going to read those manufacturer's directions and follow them for mixing and usage. Then you can go ahead and wipe down your entire area and workstation and area with the intention of removing any debris or anything that might be there. Then you're going to identify you are going to identify a disinfectant that is bactericidal, virucidal, fungicidal, EPA approved for use in a salon setting. And you are going to, of course, then find another pair of disposable gloves, because you'll have to put the gloves on in order to follow those manufacturer's directions for mixing and or using appropriate aerosol disinfectant. You will disinfect electrical equipment stored in a clean area separate from other implements. For example, that facial steamer, take those gloves off, throw in the trash, and then you need to wash your hands to finish it out. So you're going to go to the sink, wet your hands, get a coin-sized amount of liquid hand soap, wash your hands down to the wrists, and then you're going to wash the back of your hands. You're going to wash your back of the hands down to the wrist of fingers, the back of the fingers. Of course, you're going to wash those fingertips and nails, between the fingers and the thumbs. You're going to wash the thumbs and you're going to wash the wrists. You're going to do all of that proper wash for a good 20 to 30 seconds, and when you feel nice and clean, rinse everything thoroughly under the water. Then grab a disposable paper towel or towel to turn the faucet off. Dry your hands thoroughly. If it's paper towels, they go in the trash. If it's a towel, it goes in the closed container until time for laundry. And then you're going to grab your 70% ethyl alcohol hand sanitizer to finish that hand wash. Thoroughly sanitize just like you did with your hand wash. And then, and only then, you can move forward with the procedure. So that concludes your video for basic facial.